Okay, ladies and gentlemen, we are getting down to the wire here. Let's welcome PuffBarry.
Hello, we are Kyle and Allison, the engineers and creators of PuffBarry, and we have one question for you. How do you communicate?
Today, we were given 1 minute to convince you, the mentors, to believe in our product, taking advantage of an ability some no longer have, speech.
But we have a solution. Introducing the PuffBarry, a wearable, portable, assistive communication device. The PuffBarry allows users to control a device with puffs of air to actually have the device speak for them. But why is this important?
Imagine you are completely paralyzed and have rapidly decreasing amounts of muscle control. You are unable to communicate your basic wants and needs, let alone converse. This is what people with ALS, MS, and MD face every day.
Our first prototype has shown people using the PuffBarry would be able to communicate easily and effectively without the training and extensive background that current market devices require.
After a good family friend, Dr. Barry, passed away from ALS, I've since been passionate about improving the lives of those with such debilitating diseases.
There are currently no market devices that address this need as well as the PuffBarry, so with your help, we aim to get our device in clinical trials and improve people's lives. Thank you.
Wow. Congratulations. It looks like you have two teams. You have two. Adrian.
Get down.
Adrian's jumping the gun a little bit. So he seems pretty excited about PuffBarry. Maybe we'll let you go first, Adrian.
Yeah. I thought it was a pretty interesting pitch, interesting opportunity for to build a strong IP portfolio here. We at Mercury are science and software investors, and we have a couple of life science guys who could be of great help to you guys. I see it as obviously a major issue and opportunity in that sector. So happy to help.
Amy?
Well, Adrian's so sweet and well connected, but no, I think you've got a great passion, great connections, and I'd love to really try to help you further along what you're doing. I think you're in a great space, and I don't think you can go wrong.
Who's it going to be?
I think we're going to go with Adrian.
Adrian it is.
Nice to meet you.
We have PuffBarry.
Unheard, marginalized, neglected, ignored. Gone before they're gone. These are the phrases that people with ALS must say about their own lives. Across the United States, over 30,000 people are estimated to be struggling with this disease, and next year another 6,000 will be joining them. ALS is a debilitating disease that causes paralysis and eventually the inability to speak. To combat this, current devices use head and eye movements to help patients communicate. But here's the problem. Current devices use muscles that cause effect on the person themselves, so these devices can't be used by them. They are a temporary solution to a permanent problem. From our research, we found that current devices also have steep learning curves, and this gives patients one of two options. One, spend an excessive amount of time learning a device only to have it taken away from them when their disease progresses, or two, become frustrated with the difficult controls, give up, and remain unheard. However, we and many others feel strongly about a third option, PuffBarry. PuffBarry uses puffs of air to communicate. This is a faster, easier method of communication that uses muscles that are not typically affected in the early stages of ALS.
Over the past few weeks, we've talked to patients, families, doctors, and over 50 ALS-A association chapters across the entire United States to figure out if this problem really is the problem. Executive directors and care service coordinators at every single one of those chapters have expressed a need for a device with a much shallower learning curve. Speech pathologists who actually prescribe these devices to patients witness the frustration and helplessness when patients are unable to interface with such difficult devices and ultimately give up and choose to remain unheard instead of dealing with such a crappy device. Patients and families also express this need to communicate with their loved ones and stay a part of their life as long as they possibly can. We've also discovered means to expand PuffBarry, connecting it to the internet, interfacing it with mobile phones, allowing for emails and text messages to be sent with our device would allow people to communicate with people all around.
I'm sorry, guys, I got to pull you up. Congratulations. Let's bring both teams out. Now it's time for Adrian's first team. Let's welcome PuffBarry.
As you know, we started working on this device for patients with ALS after Dr. Barry passed away. He was a healthy father of 3 who loved running and yellow Jeeps before his diagnosis. This did not happen to him because he was a smoker or an alcoholic. He could have just as easily have been your father, your mother, or even you. If you had an incurable disease, wouldn't you want a device that could increase the quality of your life and let you be heard? This is what PuffBarry could do with your support.
At this point, we have this working prototype. We also have the support of both the faculty and even recognition today when we won the TEDx Prize just an hour ago. Doctors are actually the customers for our device because they're the ones who are recommended to their patients. It's because of this we have added the leading ALS doctor at the University of Michigan to our team to help connect us to patients and ultimately the users of our device.
In the future, we will continue to adapt PuffBarry to all of the customer needs, and after completing our product, we'll be going through FDA regulations for biomedical devices.
Because of these FDA regulations, we cannot by law demonstrate our device with a person on stage right now, so we're going to kind of mock it up. Here's Allison with the cannulas. She will breathe in and out. This will be connected to the pressure sensor located right here on the prototype. Up on the presentation screen, you'll see what users will see on their mobile devices. It has a code, so you can see exactly what you want to say, as well as what you've already put into the system, and ultimately speak it out. We hope that you support PuffBarry, and we believe you should. Thank you.
Awesome. Thank you very much. All right, Amy, what questions do you have for this team?
Well, I'm just so impressed with the presentation. I have to say, even though I like my team's better, but and the progress.
It's sort of hard to whack a team that's taking care of this problem. So.
No,
Exactly.
great presentation, great progress that you made over this. Great adding to your advisory board. Do you have any specific customers or a timeline yet on prototype and FDA?
Because of the fact that our clients would be people who are sick right now, we felt like it would be best to instead contact doctors, because when our product would be done, then they would be able to then influence their patient, like recommend our device, because we wouldn't want people to have a hope that they wouldn't be able to use in their lifetime.
Doug?
So, nice presentation and good job getting the prototype done.
Thank you.
How much capital do you need to get to the next milestone? How much cash?
So for FDA regulations, you have to go through both the FDA and IRB, and our device is a Class 2 device, and that means that we will have to do some clinical testing. That funding will be into the thousands of dollars, but because it is in a Class 3, then it isn't as much. It isn't into the millions of dollars.
Dawn?
So Doug asked you how far to get to your next milestone. What is your next specific milestone? And does that relate to, customer acquisition and
Wow, Dawn is playing to win today, you guys. I'm really impressed.
We are actually in the process right now of getting ourselves approved by the hospital to shadow our doctor that we've brought onto our team. This will allow us to get to the patients, get to the end users, speak with them about their preferences, what they would want in a device, why they can't use the devices they currently have, and ultimately best ways to improve this.
the milestone?
The next milestone would be that we would have a completely finished product, and then after that is for the approval to then go to market.
Adrian, wrap us
You
up.
guys did a fantastic job. We clearly have now a new best presentation yet. But no, I mean, seriously, you guys are the one team truly making an impact in people's lives, right? You're actually doing that, right? And no, you're not going to have, customer revenue right now, but, I can't wait to see where you guys take this.
All right,
Thank you.
congratulations on your TEDx win, and thank you very much, PuffBarry.